Hello and welcome everybody to the Animal Eye Guy. Today we're going to be talking about a condition called SARDS. SARDS is an abbreviation for sudden acquired retinal degeneration syndrome, and it's a condition that involves the back of the eye, typically in dogs. It's not been reported in other species so far. But we tend to see this in dogs. They come with very acute onset, so very recent history of blindness in both eyes. They tend to come in with these very wide dilated pupils, as you can see on the picture below. And they normally come with a history of having had some recent weight gain. It all happens very shortly, within a matter of a few days, or at most a couple of weeks. And it's not a painful condition. They tend to come in disorientated because they can't see and they've not had time to adjust, and the back of the eye as well as the front of the eye look normal. The only way to confirm the condition is by doing a complete eye examination, and to confirm the condition you would need an electrical function test called an ERG, which will objectify the retinal function. Well, although we've seen this condition for many, many years, nobody's completely sure about exactly how this condition develops. There are several theories about immune conditions and genetic conditions which trigger this. Patients with this condition also are reported to have a loss of the sense of smell, at least in a proportion of cases. And most of the cases also come in with a history of recent weight gain, increased appetite, increased drinking, and urination. Any breed can have this condition, although we do tend to see a slight increase in middle-aged spayed bitches, particularly dachshunds are one of the breeds which are overrepresented, but it can happen in any dog breed. Well, typically both eyes are affected in this condition. That's one of the key features of this condition. There are a few random reports about this condition involving only one eye, although this is extremely rare, and the vast majority have both eyes involved. Unfortunately, none. There are some scattered reports about um, using immune therapy and very, very high doses of um, immune therapy in order to try and regain at least some partial vision. But this is only very few people who attempt this treatment, and the treatment success is very, very hard to verify. So we consider this condition a non-curable condition, although there might be some differences in opinion on that. No, so it's the good thing about the condition that it's non-painful, and with enough time, those patients will learn to adapt, and they will learn to adjust to their blindness. We typically recommend rechecking them once a year or so, just because if the retina loses function, they can have long-term complications such as cataract formation resulting from retinal cells which are sort of dying off and releasing toxins, and these toxins can then cause a cataract. The cataract can then cause other problems such as chronic low-grade inflammation, pressure problems, we call that secondary glaucoma, retinal detachment and such. But this usually happens very rarely, and it tends to not happen for many, many years after the initial diagnosis.